everybody to the Lane County Board of Commissioners meeting for April 28th, 2020. I'm going to start out with my little information guide that we do each morning for our virtual meetings, and then we'll start our meeting up. So hello, everybody. Welcome to our virtual Board of Commissioners meeting. With this new virtual format, we have a couple of housekeeping items to review. To the public that's watching this meeting, when you registered to watch this meeting, you were registered in our system as attendees. And when you're an attendee, you are webinar participants who are simply viewers of the meeting, an audience member. Your microphone and your webcam are automatically muted as attendees. However, there'll be a time during the meeting that we will open it up for public comment. When that time in the meeting comes, if you wish to participate in public comment, I'll ask you to raise your virtual hand to be recognized. You should see the hand icon on the device you are using to watch the meeting, and simply press the hand icon once to raise your hand. When public comment begins, our meeting organizer will call names. When your name is called, you will be unmuted and given 3 minutes for public comment. When your 3 minutes is up, you will go back to muted status and the next name will be called. You can then continue to watch the webinar as long as you choose. We will try to give everyone who wishes to participate in public comment opportunity to speak, but please note in the event that there are more people wishing to comment and speak than time allots, I'll limit either the number of speakers or the amount of time allotted to each speaker, and speakers can be selected randomly. We haven't had that situation occur so far, so hopefully everybody who wishes to comment will have enough time for. So with that, we will go straight into our agenda. And the first item is if there are any adjustments to the agenda. Seeing none, we'll go to item number 2, County Administration, with our COVID-19 update.
Chair Buck, I'll turn it over to Karen Gaffney, our Director of Health and Human Services and Incident Commander for the Community Emergency Response, for a brief update and then questions from commissioners.
Thank you, Chair Buck, Commissioners, County Administrator. I am going to work hard to keep my part of the update on the brief side because there are some interesting things I would like us to have a chance to talk about that I know are top of mind for people in the community as well. So first, I'll start by giving you an update on the cases and the numbers of people who've tested positive in our community. As of this morning, we are still holding at only 50 people who have tested positive in the community. 27 of those people have recovered, so more than half have recovered, which is fantastic news. We have 0 people in the hospital. 21 people are sick at home, and 2 people have passed away. I don't have the updated negative numbers yet from this morning, but as of yesterday, we had 3,032 negative test results. So those numbers continue to increase. And later this morning, I want to talk to you a little bit about our strategies for increasing those numbers of tests. A big part of our strategy has been to make sure that we have capacity in case we have a significant increase in the number in our community. As you know, one of those strategies has been to purchase the old VA clinic out at 100 River Avenue. And we have established a terrific partnership with the Army Corps of Engineers, the Oregon Health Authority, and FEMA to be able to repurpose that building as an alternative care site in their system. That construction is underway as we speak, and they are working hard to meet the deadline to be able to turn that facility over to us by the 15th of May. And as we get a little more clear on exactly what date that will be, we'll make sure we plan some appropriate an appropriately social distant opportunity to celebrate the fact that we've been able to bring that facility online. I do want to let you know that as the formal bids have come in for that construction work, the amount of remodel and repair that's required on that facility has exceeded what we had initially thought. And those negotiations are still underway to identify the final cost, but I did at least want to put on your radar that we have set aside up to $900,000 of our delegated authority in case we need it to be able to cover those renovation costs in terms of mechanical and electrical systems and some other issues there. So I'm happy to answer more questions if you want. We don't have a final number yet, but by next week, we should be much more clear on both that number and our negotiations with FEMA and the state. We are hoping that ultimately they will pay more than the 75% of those costs that they've already committed to. So more news to come on that, but the schedule is moving along as anticipated, and we will have that facility come online in May. Speaking of the financial burn, I did want to give you an update for where we are to date on our expenditures. Again, we report those as actuals and then what we have encumbered as well. So actuals as of last Friday are 1.2 million, and we've encumbered an additional 1.4 million, which includes that $900,000 that I just talked to you about. So total to date of actual expenditures and encumbered is running a little bit more than $2.7 million, $2,744,876 to be precise. And again, our goal is to hopefully get as much of that as possible reimbursed through FEMA as the emergency process moves forward. I'd like to spend the bulk of my time with you just walking through what we know so far about the process for reopening Oregon and ultimately reopening Lane County. I know that each of you have had the opportunity, maybe multiple times by now, to participate in a presentation that the governor's office has been doing. So I'm not going to go back through those slides about the governor's plan. If people in the community are interested, I know they can go to the state website and there's materials about the governor's framework there. That framework is still in draft. So I think that's important to know. And we checked yesterday with Sarah Means, who's our representative from the governor's office, about timing for when those might be finalized. And the governor's office is still saying the week of May 4th, but not to be attached to the day of May 4th. They may come out later in that week. So it won't really be until those documents are released that we have the governor's final framework. However, I think we have the important components that she's been really clear about how she would see Oregon being able to move up to the gate and then into phase 1 and ultimately phase 2 and phase 3. We talked some about that in general terms last week, but I wanted to let you know the work that we've been doing in the Emergency Operations Center since we last met with you to take the criteria that Dr. Ludke described to the community a couple weeks ago. He talked about them as 7 considerations for reopening Lane County and map those against the governor's framework. And I want to walk through those with you and answer any questions you might have about that. Most of these will sound familiar, and I think will make intuitive good sense about what data we're tracking on before we make a decision to recommend reopening Lane County. And ultimately, as the framework becomes finalized, our intention is to publish this information so that people in the community can also be tracking on where we are with the data and be very transparent. The first criteria is falling cases over 14 days. As you know, we have been very blessed, unlike some of our surrounding communities, that we haven't had a very high burden of disease. So we will be testing or keeping track not only of our number of positive cases, but also the percentage of all tests that are positive. We would expect as we increase our number of tests overall, we may see more positives, but as long as our percentage of total tests that are positive remains low, that is a good sign of our readiness to be able to relax some of the social distancing requirements. Second piece, we've talked a lot with the board since the beginning of the outbreak, is availability of local laboratory testing. I believe I told you last week that we now have local labs both at Peace Health and McKinsey-Willamette in collaboration with the University of Oregon, who are able to do testing here in our community, which supplements the work that happens at the Oregon State Public Health Lab and the commercial labs that are serving people who live in Lane County. So for us to be able to feel comfortable recommending relaxing any of our restrictions, we know we need to be testing more people in Lane County to make sure that we are quickly able to detect whatever disease occurs in the community, and to be able to track whether there's any need to return to social distancing. So our goal, and I know we talked about this last week, is at a minimum to have 500 tests a day here in Lane County. Dr. Ledke would rather see us get to 1,000 tests a day. So 500 isn't our ultimate goal, but our threshold. And for our local labs to have at least 50 a day that they are willing to reserve for public health to direct where we need to have people tested. So that's where we will be able to do some of our sentinel testing, the surveillance work, targeted populations, long-term care facilities, those other high-risk groups. So that's number 2, is testing. The third area of emphasis for us is contact tracing and having sufficient resources to do that work. I know it's interesting. I've been in public health most of my career, and we have done contact tracing as the bread and butter of our work. And now it is this fantastic concept that everyone understands much better in the community. So contact tracing is that opportunity for us to have sufficient numbers of trained people that as soon as we identify someone who is positive, that we are able to quickly reach out to everyone who has been a close contact of that person to assess if people need to isolate, quarantine, be tested, and then if any of them have symptoms, to be able to reach out to their contacts. So you do this growing circle to ultimately then, through isolation, be able to stop the spread of disease. So we've been doing that work here in Lane County since the beginning of the outbreak. As we increase our number of tests and we may get more positives, we want to make sure we have sufficient resources to be able to follow up quickly with all of those contacts of all of those cases. So we're working with the Oregon Health Authority, who is providing some resources to assist all counties in that work. And we also have had some great partnership opportunities from those in the community, the University of Oregon, retired physicians and nurses who are willing to volunteer. So we're establishing that team of contact tracers to do that work, and we'll make sure that we maintain sufficient resources in the event that our case numbers increase. The fourth consideration is plans to be able to do a rapid scale up in case of a second wave. So what we know is that if we get significant numbers of cases, and in our community, Dr. Ledke has said, if we get more than 3 who are epidemiologically unrelated in a day, then that's a significant flag for us. So we need to be able to watch for those triggers and then be able to quickly respond, either by making sure hospitals ramp up their capacity if it's severe cases, or if there are targeted stay-at-home strategies that need to be implemented, that we're ready to do that. So that fourth element is part of our blueprint as well. Number 5, sufficient PPE. And I know we've talked about PPE since the beginning of the outbreak as well, and it was a significant concern in the beginning and is less so in our community now, I'm pleased to report. We're working with the hospitals in the community to make sure that they are regularly reporting both their burn rates, how much they're using, and their supplies on hand, to make sure that they have sufficient PPE to manage through a surge. And then we also have served as the local clearinghouse for PPE. So we have significant amounts of PPE on hand that we then distribute to providers and other priority organizations in the community. I think when Commissioner Buck was over for the press conference on Friday, she had the opportunity to see a couple National Guard trucks that were doing deliveries on Friday. We had another one yesterday. So we keep that inventory and monitor that closely to make sure that we have sufficient PPE to protect healthcare workers in our community. The sixth element for Dr. Ledke is to have a blueprint that we can share with the community about what the process is for relaxing restrictions and what it would mean if we need to increase restrictions at some point as well. And that's the document that we're working on right now. And then his seventh consideration was making sure that we had Oregon Health Authority support for any relaxation of the restrictions, that this really is a statewide concern. And while we may be in a particularly good position, it doesn't mean that the counties around us share that. And we know that the disease doesn't really respect particular jurisdictional boundaries. The governor's framework that she has released the draft of certainly meets that criteria. So in closing, on this particular part of the update, I wanted to say, in addition to monitoring those pieces that will signal to us is, as health professionals and your public health department, are we comfortable recommending that the county move forward with some relaxations of restrictions? We also will be, once that happens, monitoring for triggers. I mentioned earlier significant increases in cases. We're also tracking on how many beds are used for COVID-like illness in our hospitals. That would be an indicator of severe illness. And would trigger increased restrictions, and watching for significant outbreaks in individual communities or specific settings that might necessitate targeted action. So I know that was really fast, and I promise you we'll go through it again before you're in a position to actually take action. But I wanted to at least let you know what our thinking is, see if you have questions or comments on that. While we have time this morning, I know that it's an important conversation in the community. And then before I open it up, I just have one last piece, and then I promise, Chair Buck, I will turn it back to you. And that is an update. Last week when I was with you, we did a first reading and scheduled a second reading and public hearing on Ordinance 2003. Like many communities across the country who are doing contact tracing, we talked about how we need places for people to be able to isolate and quarantine if they can't do that at home. And we had been working hard to secure those locations, hoping to partner with hotels, and we're challenged to secure locations in Eugene and Springfield, and brought forward a draft of an ordinance that would clarify that partnership in having the hotels accept our vouchers. I know we were clear during that discussion that it was everyone's hope to not have to adopt an ordinance to do that, and that we were hoping to be able to find an alternate solution. And I'm pleased to let you know that our fantastic community partners at Sponsors have stepped forward to offer to help us during this time. They have offered access for up to 10 of their new tiny homes that have been constructed. And in fact, part of the funding for those was from our housing improvement plan. So they've offered us access to up to 10 tiny homes. When I asked Paul Solomon, the director, what he thought would be fair to charge us for those, he said that he didn't want to charge us anything for that use, that this is what people do in a crisis, is you step up and you offer to be a partner. So there's no charge to the county. We, of course, committed to cleaning those units when we're finished with them, returning them to Sponsors in the same condition that we found them. But it's a fantastic solution for us to have access to that resource here in Eugene Springfield. We also have resources in other parts of the county, and fairly soon we'll be able to bring on board our River Avenue facility. So based on that, I would recommend to the board that you rescind the motion that was approved last week to schedule the second reading and public hearing on Ordinance 2003. And I'm going to stop there. I know I took more time than usual, but that's the state of affairs in the EOC for you this week.
Thank you, Ms. Gaffney. Commissioner Bernie.
I would like to ask Ms. Gaffney some questions about her report, but before that, I would like to speak to a motion I'm about to make, and before that, I'm going to request to make the motion. I am going to move that this Board of County Commissioners rescind a second reading and any action and remove from our docket Order 20-03, which relates to amending the lane code to update, to create penalties for those lodging facilities that do not provide rooms as needed. So anyway, the motion is to strike ordinance 20.03 from further consideration.
Is there a second?
Second.
Okay, we have a motion on the floor to rescind ordinance 20-03 made by Commissioner Bernie and second by Commissioner Bozovich. Discussion. Commissioner Bernie, yeah.
Don't be so quick to get rid of the chair. I kind of like the chair we have. I would just like to compliment staff on bringing to our attention a potential need before it became a crisis for shelter. I would like to congratulate Ms. Gaffney and Mr. Mokraheisky on internalizing the need to solve this problem with the community and not require asking the Board of Commissioners to do something which stuck, I think, in all of our guts, the notion of telling businesses what they can and cannot do. I want to thank my fellow commissioners for giving staff the leverage to create a solution by indicating how serious we took this and contemplating action, which now, hopefully, if this motion passes, we choose not to take. And I want to thank everyone that brought issues to our attention. What drove this motion for me was not letters from lobbying from this or that group. What drove this motion for me was finding a solution. So I also want to thank the sponsors group for stepping up and ensuring that this community continues to keep its most vulnerable during this crisis safe and protect the community from spread. Thank you.
Any other discussion? Commissioner Farr.
Thank you for making the motion, Commissioner Bernie. We started working on the solution before the motion was made, and a number of different things surfaced. I'm glad that this one happened. When we broke ground on Jeffrey Commons, I knew it was going to be a milestone and a significant contributor to the community in its original and its future intent. When we had the grand opening out in Bethel, back in January 31st. Once again, I welcomed it, the neighbors welcomed it, and we're looking forward to the many years it will be in service. This temporary service that Paul Solomon has offered and that we have accepted is really outstanding. It's in Bethel, and 100 River Avenue is in River Road. Once again, it's pretty curious that so many of the services do end up in Bethel and or in River Road. And it's something that everybody knows, everybody keeps an eye on, and geographic separation is something that we try to maintain at all times. We try to achieve at least. Once again, I've been in contact with the neighbors in this area when Jeffrey Commons was being planned, and all are supportive in no small part because it is a wonderful community. It's a fantastic community that is going to serve the entire region for a long time to come. So Paul Solomon, if you're listening, even if you're not listening, thank you, Paul. You are a hero.
Commissioner Sorensen.
Thank you. Just a couple of questions, and maybe legal counsel can answer them, or we can just discuss them. We set this up, this hearing under the Board of Health, and I'm wondering if either Steve or Karen think that we need to get this motion under a Board of Health meeting rather than under the Board of Commissioners meeting.
Commissioner Sorensen, this is Steve Dingle. I had forgotten that the board acted as the Board of Health. That is a good point. I think it probably does have to come as sitting as the Board of Health.
Can we do this motion and then just ask that at the beginning of our next meeting, have a public notice of our Board of Health meeting so we can cancel it first thing next Tuesday morning?
Yes, I think that that's what you're going to have to do. I think you're making it clear, though, that there is not going to be a public hearing on May 5th on 2003.
Yeah. I just think that would be an additional thing to do. Well, on the substance of it, I totally agree with Commissioner Burney. I didn't want to do this. I said that when I voted for it, but it was just an important part of preparing for something. I do think that there were some legal issues that were brought up by the public that we need to address fairly soon. And namely, if we're going to need private property, then I think we should think about going through the condemnation process rather than trying to force the issue of vouchers. And, this is more of a follow-up because on the substance, I agree we should cancel the hearing. But I think that there is some legal work that needs to be done, and Health and Human Services needs to figure out a way to, in an emergency situation and planning for an emergency situation where we would actually need to condemn property for public use, rather than it be sort of a generic, you must take vouchers. And if there is authority for you must take vouchers, I think that was going to be one of my major questions next week if we had the hearing is, well, what authority do we have to make people take vouchers, as opposed to looking at the property needs that the county has. In this instance, it sounds like we need 10 units. There's no reason to try to compel every lodging establishment in the county to take the vouchers when if there's a need and it's an emergency need, then we should just identify the property most appropriate and try to enter into an agreement. If not, then use the condemnation power that we have. So I totally agree with everything Joe said. And thanks for making the motion. I'm sorry we had to do this in the first place, but I think that it's great. I guess before I finish, I would have one question, and that is, if we do get reimbursement from the federal government for this, Ms. Gaffney, is there a way for sponsors to receive that, or would we have to actually bill them for it to be put into our pile of requests for being reimbursed?
Chair Buck, Commissioner Sorensen, my understanding of the process with FEMA is that it is a reimbursement. So we would have to actually expend the dollars, and then up to 75% of that would be eligible to be reimbursed to us.
I just, this is off again, the topic of this motion, but I just think it would be good to review all that with sponsors so that if you really think we would get reimbursed, I think it would be good for them to accept the payment and have an agreement whereby they would receive payment. Thank you.
Commissioner Bozievich.
Thank you. So first, I want to say that I would really encourage us to compensate sponsors, even though they've offered this at no compensation. I understand through the PSCC COVID response meetings we've been having with our partners in public safety, that sponsors is not doing well right now. Their income streams have dropped. They've had to lay off staff, and they really should be compensated. I appreciate Paul Solomon's generous offer of not being compensated, but I think we should figure out a fair market compensation for those units that we're reserving for our use at this time, particularly in light of the fact that the governor is asking agencies to look at an 8 to an 8.5% across the board budget cut right now. And they have to achieve that for the biennium over the last year of the biennium, which means approximately a 17% cut in state funding. And that includes community corrections and justice reinvestment funds, which is also a funding stream for sponsors. So we're talking about not compensating them for something while they've already had a large loss in income, had to make layoffs, and also they're looking down the road at a very large possible cut. So I think it's really important that we refuse Paul's generous offer and we find a way to compensate sponsors. That's not to the motion, so I'm sorry for getting off the track there, but I want to make sure I said that. I just want to note that I never supported this motion, and that the reason I did that was not whether we had the legal authority to force people to take vouchers or we could eventually go into condemnation. It was the principle of being in negotiations with somebody and then having hanging over their head the force of government that was basically going to say, well, if you don't come to an agreement with us, we're just going to force you to take a contract. That principle is just wrong. And we should have just tabled it until we found that we couldn't do something, then maybe brought it forward. But having negotiations carry on while we were still moving forward with this hammer was just bad principle and bad faith negotiation. And that's why I voted not to move it forward last week. And I'll be voting in favor of the motion to rescind this. I also feel like the board can rescind this without having to be the Board of Health, because all ordinances ultimately are by charter passed by the Board of Commissioners. Doesn't really talk about the Board of Health so much. The only reason we were doing it as Board of Health was to make sure it applied inside city limits.
Commissioner Farr.
Thank you.
Thank you. A couple of things. I agree with Commissioner Bozovich that sponsors, we should find a way to compensate them if we can. They're a large fundraiser. I was at the one last year. They raised a lot of money at their fundraiser in the spring. It was canceled this year, or at least postponed. And that is where they get a large portion of their operating development capital. So they are struggling a little bit in that regard. Regarding passing the motion last time, that was not the principle that I was acting on, the hammer principle. That's not why I voted yes, and I'm not going to go into why I voted yes in this meeting. Mr. Mokrahajski, I was going to ask you, could you tell us a little bit about Lane County's involvement with Jeffrey Commons and where we were in its planning and its development?
Chair Buck and Commissioner Farr, as Ms. Gaffney noted in her comments, Lane County contributed, I don't recall the total cost of the Jeffrey Commons project in the end for the construction of those 10 tiny home units. Lane County contributed $200,000 out of our HIP program, the Housing Improvement Plan, that the board authorized. Was a $2 million grant program that the board authorized 2 years ago. In the budget, we went through an allocation process and sponsors submitted their project and we awarded $200,000 to them for this project. So that went towards those. And I think that likely factored into why sponsors wanted to offer these units. One, the units are not currently occupied, and Lane County has contributed $200,000 towards that project. So the other thing I'll just note is that, we're hoping for 75% reimbursement, but there is, of all these costs that Ms. Gaffney talked about, 25% of those costs, in the best case scenario, are likely to be the responsibility of Lane County. So there is going to be an actual cost to Lane County for the expenditures that we've made here. And I also want to note, as we'll talk more about next week when we kick off our budget process for next year, that we have a number of funds that are struggling significantly, not the least of which is parole and probation, that's funded by state Community Corrections Act funding and is going to require an 8% cut option that the Department of Justice has asked us to propose. So I know that's more than you asked, Commissioner Farr, but a little bit of sort of a painting of the picture of both our involvement in Jeffrey Commons as well as a little bit of our financial picture going forward.
Thank you, Ms. Mokrais. And Chair Buck, thank you very much for recognizing me. I will say that I still hold out the hope that we won't be using Jeffrey Commons for any purpose at all, but it's nice to have that there in case we have to. Thank you.
Commissioner Bernie.
I fail to see a reason why we have to continue to discuss intentions, ideologies, etc. We had a problem. The problem is resolved if we pass this motion. So I would like to call the question.
Great, questions called. I did want to say something because I didn't get a chance. I just want us to remember this is why it's so fantastic to have partners throughout our community that we know that
Madam Chair, point of
Yeah.
order. We had a question called, so we either have to have that withdrawn or we have to have the vote. We can't have you talking when the question's been called.
I'd be happy to withdraw so the chair can speak and then I'll call it.
Thank you, Commissioner Bernie. What I'm trying to say is, we have certain partners that we've been working with for years, decades even, within our community that we rely on in our greatest time of need. And many of them are suffering at the moment, but it's so very important for us to make sure that we can help them through this time as well. We rely on each other for services, and I can't thank sponsors enough for being willing to step forward and request at no cost of their own and offer this space. We are not getting that from some other partners in our community, but it is so extremely important that if we're going to get through COVID-19 and this pandemic or even a second wave, that we also work hard to strengthen them as well. With that, any other discussion? All right, we'll take a vote.
Well,
All those in favor, say aye.
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 All those opposed, say nay. Okay, motion passes unanimously. And we'll move on to emergency business. Any emergency business?
We don't have any emergency business today, Madam Chair.
well,
Commissioner Bernie?
can you hear me?
Yes.
The reason I prefaced that whole thing by saying I'd like to ask Karen some questions about her report. So before we move off of that, if I
No
may.
problem. We'll move back to get more questions in there. Go ahead.
Okay, thank you. So Karen, it seems as if Lane County has been barely hit. If I heard your comment, 0 people in the hospital right now, or 21 are recovered, etc. I don't know if medical staff has had the time, but there was an interesting article yesterday in the New York Times that is talking about new research indicating that population density seems to be as much of an indicator of transmission of virus as anything else. And I know there's also the example of the country of Sweden, which is quarantining and isolating everyone like myself that's high risk group and old. but schools are open and activities are continuing. So I'm just curious how you or the governor is factoring this new data that's coming to light in terms of restarting economic activity in your assessment of public health.
Chair Buck, Commissioner Bernie, thank you for that question. I can't speak for how the governor is accounting for that, but I am happy to share with you a conversation Dr. Ludke and I had last week about that very issue of population density, and a study he had been reviewing that looked at cities across the country. They didn't happen to pick Eugene, but they did look at Bend and excuse me, and Salem. And so we're making some assumptions based off of density, for instance, in Salem as it compares here to Eugene. That factor is critical for us as we look at planning for our resources and also, I think, making some of our projections moving forward. So for instance, on this question of contact tracing, when we're determining how many FTE do we need in our community to appropriately do that, the state is looking at a formula that says 15 FTE per 100,000 population. What we know is there's no way we need that many people right now in our community. It's a very different situation if you're in Washington County, given their number of positive cases and all of the contacts they have to look at. So for us, we're using both our number of active cases and our population density as part of, as a factor in our formula for determining how many FTE we really think are sufficient in our community to be able to do that. So that's one example of where we absolutely are using that data as a consideration for us moving forward.
The Times article, just FYI, did not consider the Portland metro area high density in terms of increasing spread or death rate. It was looking at cities like, I don't remember offhand, but I was blown away that the Portland metro area was not considered high density for the research data that was going on in that. But hey, thank you very much. You guys are doing a great job. I'm one of those that thinks there are smart ways to open up economic activity now, even before the first gate, I guess is what it's called. But I'm one voice, and my understanding is that we have to wait until there is a protocol and guideline finalized. Last question. You said that when the governor's PowerPoint, thing on reopening Oregon, which I'm looking at now, is finalized, we will publish it. Is there a reason why it's a bad idea to put it in our minutes, even in draft form, so other people can look at it and provide input? Or would that just get out of control?
Chair Buck, Commissioner Berney, I was under the impression that the governor's office already had that posted for people to be able to link to, and I'm happy to double check and make sure that's true. I think the only consideration I would have is I would prefer to just have a link to the governor's office just so that people were always getting the most current version, because I know last week there were several versions that came out as her thinking is evolving.
Thank you very much. Thank you, Chair.
Commissioner Farr.
Thank you. Ms. Gaffney, I'm not going to ask you very many questions because that was a very thorough report, covered all the points that I had, all the questions. Looking at Dr. Ludke's 7 pillars to reopening, very well written. There's one in particular that doesn't stand out in everybody else's pillars for reopening or conditions for reopening, and that's the 6th one, where Dr. Ludke also says we need to understand what it would mean if we have to increase restrictions based upon a second wave. So that's an interesting and important point that Dr. Ludke is making. And I'd like to say how fortunate we are that Dr. Ludke made a decision to change his career path and come to Lane County when he did, I believe it was 7 years ago. How fortunate we are, because this seems to be his life's work, and we're benefiting from the work that he's been doing really all of his life in the medical field. And Ms. Gaffney, I do have one question, if I may, and that is with the positive cases hovering statewide and here at about 5% of all tests, I have a lot of people asking or stating that they think they've already had it, that they've already had it back in February or March. They had all the symptoms, they got better. And I'm hearing that across whatever channels of communication I hear. What does a test tell us about people who have already had it, or is there a test, and will there be an opportunity for people who think they've had it to know that they have had it and potentially are now immune?
Chair Buck, Commissioner Farr, thank you very much for circling back to the issue of testing. One of the things that I want to point out for the board and for the listening public is that last week we did have a shift in the guidance from the Oregon Health Authority to providers in the community about who would be appropriate for testing. And in this part of my answer, I'm talking about PCR testing to see who has active disease. So some of the tight restrictions that existed before have been loosened in that way now. So certainly if there are people who are ill and think they might have this coronavirus and are afraid that they wouldn't be eligible to be tested, they still should reach out to their providers because there is increased access to testing now. And we very much would like to be able to test those people who are ill and think they might have the virus. So that's just an update from the state that it's easier to access that testing right now. Your question about people who think they might have been ill before and developed antibodies as a result of that, there is serological testing that has become available now, and I know that there is some availability in this community for physicians to order that testing. We've had a couple of those results come back to the health department. Because those are also mandatory reporting to the health department, just like the PCR tests are. From the health department's perspective, we know at some point that information will be very useful. It isn't our focus right now because we're working hard to combat the current spread of disease. The interesting science that I think is still being developed is to what degree do people actually gain immunity if they've been exposed and had the disease. And I know that the answer on that is not clear and has been shifting some over the last couple of weeks. If people do get immunity, then that will be very helpful as we go into what could be a hard fall as the disease does a second wave. But that's not clear to what extent there is immunity. And so I believe the FDA is continuing to work to make those tests more widely available, and over the next weeks and months, I would imagine that will become more easily available, but it can be ordered in our community right now.
Thank you, Ms. Gaffney, and thank you, Chair Buck. Ms. Gaffney, you've said out loud on camera what I'd heard privately and said off camera. So thank you for saying that out loud. That is what I'll report if people ask me, what about me? What about me? Which is what I hear quite a bit. Thank you.
Any other questions or comments? Commissioner Bozovich.
Thank you. So I will note on the serological testing, the one interesting thing about that is as we understand how widespread the actual infection rate is, it does adjust our understanding of both hospitalization and mortality rates for this particular virus, which may adjust our degree of precaution. So if it turns out it's much more widespread and we have a much more lower mortality rate, less than some other diseases that we don't close the economy down for, we might change our response. So there is some public health benefit to understanding that. But I will note also that the current serological testing has a high false positive, and it hasn't been perfected yet. So you have to deal with that and understanding the numbers too. I want to talk a little bit about this whole blueprint idea and how we're going through this phased operation, because I am hearing from small business owners that are getting ready to go under, that don't qualify for PPP loans, that don't qualify for some of these various rescue help, and they don't fit the mold of what we think about. I have one person that has a single chair hair salon, where they could actually bring one person at a time in, have, clean their station, sterilized it, have their customers and themselves wear masks, wash hands between clients and all that, and have almost no ability to transmit, and that person is like telling me they can't wait another 2 or 3 weeks for some wide blueprint that's going to include her case. I also have campground owners that have RV spots where people come in completely contained and they could shut down their common bathrooms and showers and not take any tent campers and get back into business in that way, where people are self-contained in their own campsites and sanitize the hookup areas between clients and all that. So I'm kind of a little bit concerned that we're trying to do a huge one-size-fits-all and not having maybe some method of people applying for exceptions and exemptions and opening up even earlier that maybe don't pose as great a risk to a second wave and the ability to try and get some income back into their households, because study after study after study ties poverty, which losing a business generates for people, to poor long-term health outcomes. And we're at risk of solving one health crisis and creating a completely different health crisis as we drive people into poverty by overreacting. So how do we balance those exception sort of businesses, that have, been closed down under the governor's order, but seem to fit this mold of not being very risky, and also their clients have the ability to try and decide, is that risk too much for them? As we've seen in some of the states that have reopened, there are businesses that have chosen not to open because they felt they couldn't mitigate the risk. So it's not like allowing them means they'll necessarily open, but I just wonder, how do we deal with some of those exceptions like this single chair hair salon?
Chair Buck, Commissioner Bozovich, I have also heard from people who are struggling with those same concerns, and from a policy level, trying to weigh the costs and benefits of each choice. As you know, our current restrictions are ordered by the governor. So in our current situation can only be changed by the governor opening up and easing some of those restrictions. And we're seeing some of that already starting to roll out, for instance, with relaxing some of the restrictions around medical procedures that's scheduled to happen. So I think as the data supports those changes, we'll start to see some of those options open up. I know that one of the reasons she's taking a little bit of time on finalizing her roadmap to reopening is to get sufficient input from some of those sectors. Last week, and I think into this week, she's convened groups specifically around our parks, for instance, and camping. I know the very question you just raised about, isn't our self-contained RV camping, isn't that a different thing than tent camping where everyone shares a common restroom, for instance? So I know some of those questions are being raised and may influence how she rolls out what happens in phase 1 and phase 2 of what types of things are allowed as that moves forward. And similarly, there's a task group on those personal care services, including barbershops and massage therapists and others. So my sense is that she's hearing from people about the range of activities, and hopefully there'll be some accommodation as her plan gets rolled out for how those people can fit in.
So, Chair Buck, just to finish up, I'd like to encourage the board, and maybe we need to have a discussion of this under board business, to ask the governor to make sure that in her policies, there is a local exemption process that we can execute. No different than other counties have submitted letters to the governor, and some have actually moved forward with phase 1 beyond ahead of the governor, like Douglas and some of the Southern Oregon counties. And into phase 1, but it'd be great if we could just encourage the governor as a board to allow local governments to make exceptions to the statewide orders based on a case-by-case basis of some kind, because we are really having folks out there that are at the edge of financial ruin. They've gone through their savings. They can't access unemployment because of our antiquated computer system in this state. They can't get PPP because they don't have the correct records and all to back it up, or they don't even have employees to spend the 75% of the PPP on. So we need to have a way to get some of these people back viable that aren't a large risk. The single chair hair salon, the completely contained RV camping. I know I've got my RV. When I go to some of those campgrounds, we don't interact with the other campers. We have our own campsite and we stay on our own campsite, because we've got shower and bathroom facilities in the RV. Part of it's because we have dogs and have to take care of the dogs. So it seems like we need to provide some kind of method of getting some of these businesses back in business, or we're going to suffer a wave of health problems down the road because of the poverty that's going to create. And waiting, it's great we're getting, some of these medical procedures opened up. I have a friend that got kicked off. He was supposed to get a hip replacement the day they shut down those procedures and didn't, has been waiting for hip replacement this entire time. But that doesn't solve the hair salon's problem. And the hair salon may be weeks down the road in the governor's order. And I think we need to get the governor to give local governments more flexibility to look at case-by-case situations and allow some businesses to reopen that aren't large threats prior to having everything else that's in our 7 pillars. I don't understand how that rural hair salon is going to create the second wave. So that's all. I just would ask the board later on to consider a letter to the governor.
Mr. Sorensen.
Thank you. Karen, I just wanted to circle back to 2 questions. The first was, I just wanted to make sure I was writing down the numbers: 0 hospitalizations, 2 deceased, 21 recovered. And what was the total number of tests and the total number of sick people?
Chair Buck, Commissioner Sorensen, it was 27 recovered and 21 sick at home. And as of before we started the board meeting, it was 3,032 negatives. But I will use my other computer here to see. I think we probably got an update at 9:30, so I can pull that more current number and get back to you before you conclude this item.
Okay. My second question is, my understanding from the AOC phone call on Friday with the health division, health authority, excuse me, that, and maybe it was some AOC listserv, but that some counties have already submitted requests to reopen. Do you know how many have submitted requests to reopen? And if the criteria hasn't been released, how would the governor's office rule on those requests?
Thank you, Chair Buck and Commissioner Sorensen. I do have the updated numbers. As of this morning, it's 50 positive, at least 3,142 negative tests. We still have 0 hospitalized. There are now 28 people who have recovered and 20 who are sick at home and 2 people who have died. As for how many counties have submitted, sometimes I've heard them referred to as petitions, sometimes letters, requests to the governor. I actually don't know the count of those. Last night, somebody forwarded to me one that went from Baker County. So I know that those are coming through. My sense is it's largely from less populated, more rural counties in the state, but I don't know how many. When we asked the governor's office representative about the approval process, kind of with an eye toward how does that timing work, what we were told is that the governor's not taking action on anything until she releases her final plan that's clear about the criteria and what needs to be addressed. So that's the information I have most current, is that they may be submitting those requests to the governor, but that the governor isn't acting on any of those until after she completes the work on her roadmap.
Commissioner Burney.
I just want to reiterate my perspective on a couple of items that Commissioner Bozovich brought up. I've heard from no less than 17 local businesses in Springfield, the most recent being a individual photography studio, that they have already thought through how they could in fact abide by social distancing and by cleaning surfaces and what have you, and are desperately looking at going out of business. I also, and I'm not one of these people that's like, you know, if I may, Commissioner, I'm not a mass libertarian. I'm just trying to look at a solution to a problem. Another example, I think it is a sin of omission that this country and this state has not been keeping all local restaurants open by paying them to prepare meals for in an environment where food banks don't have enough money, they don't have enough food. Ag business, which I used to participate in, is plowing crops under because there's not the demand for the food at the restaurant level. At the restaurant level, they don't have to package it in individual packages, which they do for grocery stores. By the way, with many crops, the cost of packaging and moving the product to where it's going for consumption is as much or more than the cost of growing the product. So I don't see why all restaurants haven't been open, paid. People that have been wait people become drivers. We keep people employed. We keep an infrastructure going. We keep people fed. There's a lot of aspects of this that to me are not gated phenomenon. In other words, they don't relate to, at this stage we do one thing, at this another. So all I want to say is, my experience, for what it's worth, is the best solutions occur closest to the ground. The best solutions occur where products or services are being developed or delivered. And so when it's time, I'm going to request as soon as possible a work session be put on our agenda to not just talk about waivers and exceptions for some businesses, which I agree with, but also to talk about some solutions that this board can agree on and forward to the governor for her consideration. Thank you for allowing me to pontificate, Chair.
Okay, with that, I'm going to move forward because we have some people in the audience and they may be wanting to do public comment. So let's move on to item 4, public comments, and I'll let the moderator take over at this point.
Thank you, Chair Buck. One moment while I bring up the timer. If you would like to participate in public comments, please raise your virtual hand at this time and I will call upon you. It will take me a moment to get the timer set and then I will unmute you and your timer will begin. Our first speaker will be Albert LePage. If you give me one moment, I will unmute you, Mr. LePage. Mr. LePage, you may begin your public comment. Mr. LePage, are you there? I will move to Adam Bradell and come back to Mr. LePage. Mr. Bradell, you can start your public comment.
Thank you so much. Good morning, commissioners and staff. Thank you again for all of the work you are doing during this difficult season. My name is Adam Bradell. I'm the pastor at the First United Methodist Church of Eugene. During the colder season, we serve as the Egan Hypothermia Shelter for homeless youth in our community. I attended the commissioners' online meeting last Tuesday. Just wanted to provide an update. I remember county staff saying that an emergency shelter for homeless youth could open with private funding as soon as the next day, which would have been Wednesday, April 22nd. Of course, as of today, April 28th, has not opened. There is a hope it might open by May 1st, but if I were challenged to provide any evidence to substantiate my hope, I could not. But in my profession, I deal in unsubstantiated hope all the time. So we will press on. But for our county to balk at providing resources for unaccompanied minors during a public health crisis is just unconscionable. And the inability to work well with community-based organizations reveals a critical lack of capacity that could jeopardize future disaster response. Commissioner Buck, I so appreciate your remarks moments ago about the importance of community partnerships. And I think it's tragic the way this experience has eroded our confidence and trust in county staff and officials. And that may have far-reaching implications when it comes to our ability to serve the poor well. Of course, your voice with county staff might yet be helpful. Advancing the well-being of homeless children in our community is about as good of a use as any I can imagine for whatever power we have. So thank you again for the good work that's being done. You and your teams remain in our prayers.
Thank you for your public comment. Our next person will be Sean White. Give me one moment to adjust the timer and I will unmute you. Oops. I apologize, it should be Sean Winter. And Sean Winter, you are ready for public comment. It looks like you're still muted, however.
Oh.
There you go.
Hello, my name is Sean Winter. I am a local small businessman and I volunteer for the Springfield Eugene Tenant Alliance. I just wanted to speak real quick to the governor's current eviction moratorium, which I think is a really positive step. As a volunteer with the Tenant Alliance, though, I'm really nervous about what's going to happen when that moratorium ends and when renters are suddenly liable for 4 months of back rent on July 1st. I think it's really important that we have a rent repayment grace period. I know Multnomah County and the greater city of Portland has enacted a 6-month grace period. Given how many Lane County renters were already cost burdened with their rent, according to HUD, we're at 52% of Lane County residents are paying 30 to 50% of their income on rent, and that was before the pandemic. So a lot of these citizens are in a really precarious financial position, and I don't know how they're going to manage paying the back rent all on July 1st without there just being an epidemic of homelessness and evictions. Commissioner Bozievich mentioned the poverty sort of escalation that's going to happen with small businesses. Many of those are renters. I just imagine everything escalating really quickly unless we get out ahead of things and offer some kind of rent repayment grace period, if not some amount of rent forgiveness for those back months of rent. It's also been recommended by other cities that we use some amount of the CDBG funding to help tenants with rent relief. I would recommend to the commission that we insist upon landlords accepting CDBG funding for their rent payments, that they accept a certain write-off, maybe 20%, maybe 30%, maybe 50%, whatever the commission wants to declare, but taking some write-off to meet taxpayers halfway who are pulling together to help keep these renters in their homes so that we don't just have like a total disaster in our housing market that's going to ripple through our entire economy. I think also going along with that, it's important to have a moratorium on lease break fees. Many people are in an awkward situation. Maybe they're students who are here at the university and they need to get home and they're just sort of stuck here with no job, no way to pay their rent. I think we should allow them to leave their rent. So I think we need a rent repayment grace period, and if not, and some forbearance on rent payments, some rent forgiveness. Thank you.
Thank you for your public comment. Our next speaker will be Kevin Cronin. Give me one moment to adjust the timer and your microphone will be unmuted. Kevin Cronin, you are unmuted.
Okay. Chair Buck, members of the board, for the record, my name is Kevin Cronin. I live at 3655 West 13th Avenue in the Churchill neighborhood. I'm here today as a board member for the Springfield Eugene Tenant Association. CETA runs an all-volunteer tenant hotline so that renters can call and get their questions answered. We help navigate tenants to additional resources. We partner strongly with the city of Springfield and Eugene. As expected, our hotline has experienced a significant increase of call volume as our community sees the economic ramifications of this pandemic. So approximately right now, 41% of all households in Lane County are renters, or that's about 60,000 households. So of those, more than 60% of all renters in Lane County are low to moderate income households that earn less than 80% of the area median income. Of these, approximately 37,000 folks, 83% of those folks are cost burden. This means that prior to the coronavirus, 31,000 households in Lane County spent more than 30% of their income on housing costs, and more than half of these costs, given their high cost burdens before this downturn, they don't have a cushion to cover rent for several months and are at serious risk of homelessness or housing instability once the crisis ends. It's worth noting that around half of the people in Oregon who have filed for unemployment have not received it. Many people who qualify for unemployment benefits have yet, or have lost wages due to this crisis, including people whose hours have been reduced. They also haven't been getting unemployment. Leading housing advocates around the state have recognized that households that were at or below 80% of AMI before COVID are the most vulnerable. We are particularly concerned about low-income renters who don't receive any form of current government rent assistance, as these people are the most vulnerable in Lane County and elsewhere. People who get evicted will have nowhere else to go, no money to rent, and eviction for non-payment will impact their credit score. There's widespread recognition that money around the state allocated to rent assistance will not be nearly enough to meet the need. And SETA urges the county to establish rent assistance funds to plug in at the anticipated gaps at the state level. In addition to establishing a county rent assistance, we're asking you to adopt a rent repayment grace period and a moratorium on lease break fees, specifically for folks that have been directly impacted by COVID-19 or are unable to remain in their lease, including those who lawfully reside in less traditional dwelling situations such as roommates or who share a home or apartment. There should be a moratorium on lease breaking fees.
Thank you for your public comment, Mr. Cronin. We will now move to Mr. LePage. Mr. LePage, I'm going to reset the timer and try to bring you back on again. One moment. Mr. LePage, can you hear us? Mr. LePage, I think your phone might still be in a mute status and we cannot hear you at this time. I did get your letter that you sent for public comment, and it has been attached to our agenda under public comment material. So I do know the board can read that. At this time, I'm not sure how to proceed since we can't hear you. So I'm going to ask if anyone else has additional public comment to raise your hand. At this time, Chair Buck, I believe that ends public comment.
Okay, thank you. Any remonstrance? Commissioner Sorensen?
Thank you very much to all of the public commenters. And thank you, Mr. LePage, for submitting your written comments as well. I think your idea of a letter to the congressman is a good one. And I really appreciate you following up on your letter. And I'm sorry you couldn't present your public comment today for whatever reason. Maybe you had to leave. I don't know. Anyway, regarding Mr. Cronin, thank you so much for the statistics. And also, I think it's Mr. White. I forgot your name. I'm sorry. I didn't write it down. But your statistics were very powerful in terms of what is happening to this large population within Lane County, the renters, residential renters. And I really, I really like your idea of a county rent assistance fund. I'm not sure where all that money would come from, and I don't know how we would establish a criteria for using it. But I really like the idea that if we could establish that fund, and I think it was the other commenter pointed out that maybe the funds could go directly to landlords in order to keep people in the units, in their apartments. We know that the cost of putting people back in, going into homelessness and then trying to get them back into housing is very expensive. And so this idea of a rent assistance fund, I think really makes some sense. And using funding that the county receives might be a way of helping this population with the economic catastrophe that's going on. And I just wanted to thank you and encourage you to continually send us information on the plight of these renters. And thanks for your assistance and hotline that helps renters. And if you can include that phone number, maybe the next time you make your public comments, that would be helpful to renters who may be listening to these meetings or looking at your comments online. Thank you so much.
Any other remonstrance? Commissioner Farr?
Thank you. And in terms of renters, we all know people, including our families and including our neighbors, who are suffering from the high percentage of their income that they're paying in rent and the vulnerability that they face right now, particularly if they are faced with having to pay back rent. Pastor Brittle, this is to you. I wrote down a quote of yours, and I'm embarrassed to have to restate this. I'm embarrassed that we as a county are not able to act upon the things that you and I have been talking about for the last 4 or 5 or 6 weeks. And you said, and I quote, "I think it's tragic how this experience has eroded our confidence in county staff and officials."
Any other remonstrance? Commissioner Bozievich?
Thank you. So I want to thank Sean and Kevin for their public testimony. That's almost exactly my point about needing to get as much of our community back to work as possible. I think, and having the ability to pay rent is one of the reasons why that's so important and why we need to look at maybe some greater authority locally to make some of those decisions and get people back to work. I will note, though, the concept of forgiveness and all that coming from the government please understand that that's a taking without compensation. And we'll either end up in lawsuits with landlords, or we'll end up having to compensate landlords if we do something like that. So I'm very reluctant to walk into the territory of things like waiving parts of a contract as a government without knowing that we've got the resources to compensate for those waivers to the actual owner of the contracts. So that gets to the whole idea of rent assistance. Grand thing, there's this whole HUD department at the federal government that supposedly does that through Section 8. And we can see how quickly our Section 8 lottery fills up and how few people actually get Section 8 vouchers. So we've already oversaturated one form of rent assistance. I think that's going to have to come from the federal side. And maybe that's something we can lobby for in CARES 5 or whatever number we're up to now, is some form of rent assistance that goes out to local governments to distribute, or even through the housing agencies like Homes for Good to try and alleviate some of those issues. We just don't have the resource, and we're actually staring at a cliff coming up relative to revenue, et cetera. Including, Mr. LePage's idea of providing some kind of property tax relief. That's really going to have to come through the state, because property taxes are under state statute, and any waiver or relief is going to have to work through the state. And it was something that I tried to bring forward to the legislature if they'd gone into short session, and they just didn't. So I appreciate the public comment, and I appreciate some of the ideas out there. Just got to think through some of the ramifications.
Speaking of Mr. LePage, we think we might have the issue resolved. And so I'm going to pass it back to our moderator to try one more time to get that public comment in.
Mr. LePage, I will go ahead and unmute you and begin your timer. Mr. LePage, you've been unmuted. It seems like we are still having the same issue. We cannot hear you, Mr. LePage. I apologize.
Sorry, Mr. LePage, but we did get your public comment written. And so I appreciate you sending that in. I want to encourage anybody else who is having trouble getting online and wanting to participate to submit any written or public comment in email or writing to us, and it'll be ensured that it gets to us. Mr. Mokrajski, yes, I believe that you have one thing too, and do you want to do Chair Bernie first?
Let's go. Well, I'll always do the commissioners first.
In your title on my screen,
Well, my title on my screen says Vice. So I wanted to just join, thank you, Chair. I wanted to just join the other commissioners in thanking the pastor and Kevin and Sean and Al for your testimony and your input today. I think you were all speaking to issues that I also see, don't always have the answers, but I appreciate some of the ideas. I mean, before the pre-COVID-19 environment, the ultimate issue underlying a lot of this relates to the distribution of wealth and resources and opportunities generally. The way that transmits into housing has meant that this area before this environment had a constrained rental market, I think sometimes second to none, first or second in the United States. An obvious shortage of affordable housing, and affordable is a subjective term, but obviously for those most in need, as I think Kevin Cronin sort of gave us a little statistical rundown there. So I appreciate the shared recognition. I share the recognition. We all are in an environment where we have a federal government going into massive debt and attempting, although some of those attempts may be structured well and some might not be. I mean, that's for argument. I never thought of the notion of a community development block grant being utilized for any kind of rental assistance or eviction moratorium assistance, et cetera. I share the concerns. I wish I had answers. I don't, but I appreciate the testimony and the compassion. Thank you.
Mr. Murkowski.
Thank you, Chair. And I just wanted to provide some clarification regarding Reverend Brindle's comments. And I have reached out to both United Way and St. Vincent de Paul and confirmed that United Way has provided the resources for the youth shelter to open. And St. Vincent de Paul is prepared to operate that shelter. The issue, as I understand it, is that the church has not agreed to a lease with St. Vincent de Paul for the operations. So I think it's really important here that we just get the facts on the table. There's, and it's challenging sometimes in times of emergency and crisis that emotions run high, and then accusations start flying and rhetoric. And so I want to encourage all of us to make sure that we're putting the facts on the table. We're considering those, and as Chair Buck, as you talked about earlier, that we're working together with our community partners to solve challenges. And I want to just say this notion that Lane County has done anything other than step up every time that we've been asked to solve a community challenge, particularly related to this current crisis. Lane County has made our properties available. The Wheeler facility and the Expo facility has funded homeless respite sites in Eugene and Springfield, has purchased the former VA clinic for $1.8 million and is currently renovating that facility, has found a solution that doesn't allow us to require hotels to take unhoused individuals that test positive for the virus by working with a nonprofit organization, and is currently and actively working on a long-term youth shelter solution on our MLK campus. So these are all things that we remain committed to, and every time that we've been called to act and identify solutions, we have done that. And we've responded to all of these things and want to continue to support that need for the temporary youth shelter and our community partners that are making that happen. So I just, again, want to reiterate that the youth shelter is ready to go. The funding is available. The nonprofit organization is engaged and ready to operate. But there's a logistical issue between the church and the nonprofit organization to execute the legal documents to make that happen. So we will do whatever we can to help support and facilitate that work. And we look forward to seeing it up and running as soon as possible.
Any other remonstrance? I'll just add a little bit on that particular subject. As we look for long-term solutions for youth housing during the COVID-19 period, it is determined to be highly unlikely that FEMA would reimburse the county for expenses for that particular expenditure, as much as we so wish we could do more housing. And that's presented a limitation, a pretty serious limitation, but I'm glad to see that there are other community agencies stepping up to help out. I also wanted to address the tenant issues that were brought up during public comment. They're all pretty serious issues for our large tenant base, since we are a college town. And we see a larger proportion of renters here struggling than towns that may not have the same demographic. And I know that the Tenant Alliance is doing a great job trying to help and support those people and advocate for their needs, and I appreciate that very much. I've been watching the issue pretty tightly. I know that tenant rent relief funds is a big ask, and our state, like was mentioned, most likely won't have the same funding or enough funding for it, which means the county would have even less. But we really need to look and advocate at a federal level for any kind of tenant relief and mortgage relief that people need, because it when it hits one section of it'll hit another section. Tenants can't pay, people can't pay their mortgages, and we'll be back in another recession that we had last time with mortgage foreclosures. So there are links in there that break during this kind of a process. And I know that I'm very interested in seeing and researching what kind of resources we can bring our way down to the county to help relieve that pressure. Timing is always an issue because we know that rent is going to be due on the 1st every month, like clockwork. And the same issue will continue to resurface until they can pay their rent and get back to work. So thank you for everybody's public comment. Mr. LePage happens to be in my district. So if it happens to be internet access or internet streaming issues, I can feel your pain. And thank you again all for being willing to participate in our virtual public comment period. If there's no other remonstrance, we'll move on to the consent calendar. I just want to point one thing out prior to moving forward with the consent calendar item. There is an item on C1 regarding the matter of approving HUD continuum of care. This potentially could be perceived as a potential conflict of interest for me because we know that continuum of care grant has co-applicants with St. Vincent de Paul, and I'm related to the director of St. Vincent de Paul, but they have very separate paths, and that's made clear in the documentation. So I'm going to vote with the rest of my fellow commissioners. So at this time, I would entertain a motion to pass the consent calendar. Mr. Sorensen, or Commissioner Sorensen.
Thank you, Chair Buck. And at this time, I'd like to move approval of the consent calendar.
Second.
Okay, moved by Commissioner Sorensen, second by Commissioner Burney. Any discussion? Seeing none, I'll call the vote. All those in favor say aye.
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 All those opposed say nay. Motion passes unanimously. With that, we'll go to County Council announcements, 7A. Are there any County Council announcements?
There are not, Chair.
Okay, with that, we'll move to item 8, County Administration announcements.
Thank you, Chair and Commissioners. Next week, I'll have more information to share about return to work and reentry of workforce planning that we're doing. No major announcements in terms of big shifts there, but I'll have more information on our work to plan for that next week. Today, I just wanted to provide an update on elections. Voter registration deadline is today, Tuesday, April 28th. This is also the deadline to change your party affiliation. You can go online to register or update your voter registration if you have a valid Oregon driver's license, DMV issued identification, or a learner's permit no later than 11:50 p.m. tonight. Other registration options include mailing a completed card to elections with a postmark from today or depositing it at the elections drop box at 275 West 10th Avenue in Eugene no later than 5 p.m. today. We have mailed 1,566 out-of-country military ballots on April 3rd. 867 out-of-state ballots were mailed on April 20th. All other local ballots will be mailed on Thursday, April 30th. So this Thursday, all local ballots will be made. Last minute registrations will be mailed no later than May 4th. So if you're a last minute registrant, we'll send those out on May 4th. Our 20 Dropbox locations will open on Thursday, April 30th and remain open until 8 p.m. on Election Day, May 19th. For any questions concerning the election or voter registration, you can contact staff from 9 a.m. to noon and 1 to 4 p.m. daily at 541-682-4234 or visit our webpage at lanecountyor.gov/elections. I'll just remind folks that the earlier you cast your ballot, particularly in this election year with all the challenges and the staffing challenges that we have to process this election, the better. So when you get your ballot, make sure to turn it in. And I'll just again note the incredible vote by mail system that Oregon has in place that allows us, particularly in this pandemic, to be able to continue the need to have open and fair elections in our democracy. And I think it's a great model for the country to be able to watch that our elections will continue while others have had to stop. That's all I have, Chair, unless there are any questions for me.
Any questions for our administrator, Commissioner Bozovich?
Thank you. Somewhat unrelated to your announcements, but in our consent calendar, we approved support for the bill grant for Eugene and Springfield. And I was curious if the county is looking at any bill grants for planning dollars for some of our highway projects and other projects as in anticipation that there may be another federal stimulus package that is for infrastructure. And the last recession, we kind of missed out on federal stimulus dollars because we didn't have shovel-ready projects. So I'm just kind of curious, are we working on our own bill grants for planning so we can get to the shovel-ready stage?
Yes, Commissioner, and I can follow up with our staff, particularly in Public Works, and get you more information on that. I can provide that next week, but we are. And you may recall that we added back, I believe in the last fiscal year's budget, we added back the grant writing position that had been eliminated around 2015, 2016. We added that position back because we felt like it's really important for us to continue to pursue state and federal funding where available, and that certainly will pay off during this time. So I'll check and share more information with you next week, but absolutely we are monitoring and pursuing all available funding for planning and construction dollars, particularly related to infrastructure needs.
Any other questions? Commissioner Berney?
I just wanted to follow up on that, if I may. As you get back to us on that, I would be very interested in the definition of shovel ready. I think that was misused last time, and yet there might be opportunities to take advantage of that for Lane County. I would also like to, as it relates to that and some of the infrastructure package discussions some of us have been having with the feds and our representatives there, think that this might be an opportunity to redefine shovel ready. For example, every roof that's structurally stable is shovel ready to have solar put on it. Every area that's properly permitted for, especially in rural areas, for duplexes, triplexes, fourplexes, maybe shovel ready to start building. I just think there may be more opportunities we could unwrap or create for Lane County and meeting existing needs. So I just wanted to make that one comment in terms of unwrapping it a bit more when we have that discussion. Thank you.
Any other questions? All right, seeing none, we'll go to item 8B, which is Order 20-04-28-04. In the matter of establishing a temporary exemption to policy for applying and accepting federal and state grants, applications, allocations, or other fiscal aid arising from the COVID-19 pandemic. And with us is Mr. Kyler, our Intergovernmental Relations Manager.
Good morning, Commissioners. Can you hear me okay?
Yes, we can.
Okay. So you should have before you a memo and a board order describing this. It's definitely related to the COVID-19 pandemic, and in particular, the fact that Congress has now passed actually 4 acts that have been signed by the president into law that have dealt with various response issues. The biggest of which is called the CARES Act, and it had in excess of $2 trillion of federal spending. In reading through that bill, it became apparent to me that there was just such a plethora of different agencies that had gotten significant appropriations that we would see, just a bundle of grant applications and other funding streams. And as we began to dig into the act and try to organize the Lane County sort of readiness to be able to apply for those grants, one of the things that came up was that some of these dollars are going to move very quickly, and that the existing procedures for grant acceptance and in certain cases applications could become a barrier. So what this order does is establish an exception to establish procedures both in the Lane Manual and the Administrative Procedures Manual that govern how Lane County typically manages grant applications, and instead creates sort of a streamlined approach which is temporary in nature. So this order, you'll see, does expire on September 30th. And we hope that by that point in time, we will have gotten through the bulk of these grant applications. And if not, certainly we might have to revisit with the board. But the point is, it's meant to be temporary in nature. So the exception to the rule is that staff would not come to the board as typical to get an acceptance of getting federal funding. And instead, you will get an update from the county administrator periodically as to federal money that have come from the COVID response acts. So just to give an example, in the CARES Act, and even the very first bill that was passed was called the Emergency Supplemental Appropriations Act. We've already seen, I think we're probably approaching $2 million now in funding for our community health centers and our public health emergency preparation related to the COVID response. And we're sort of in the midst of receiving some money from the Department of Justice that was appropriated for public safety issues. So those dollars have, in the case of the community health centers, came directly to Lane County. In the case
Mr. Kyle,
of the
you
public
cut
health
out on us a little bit. If you can repeat. Mr. Kyle, you're cutting out on us. If you might be able to repeat some of the last few statements.
Okay. In the case of the community center dollars, those came directly to Lane County. In the case of the public health emergency preparedness dollars, to the state of Oregon, Health Authority first. The point being is some myriad dollars and so we will try to make sure that the board is aware of the dollars that come in, but again, we're just trying to streamline the process. So I think with that, looking and if you have any questions for me, I'm happy to take them.
Commissioner Sorensen.
Thank you, Chair. I'd like to move approval of the order as presented and then make a few comments if it's seconded.
Second.
Okay, order 20-04-28-04 was moved approval as presented by Commissioner Sorensen, second by Commissioner Burney. Discussion, Commissioner Sorensen.
Thank you very much for getting this order together. I think it's really important that it have a sunset on it. And I think a follow-up to the board meeting today is to make sure that we are watching the sunset so that we bring it back for consideration in mid-August, or, a couple of weeks ahead of it expiring, so that we can assess whether or not we need to keep it going or not. And the other thing I was going to mention is that this is one of the high risk areas that our performance auditor would be looking at to make sure that federal money and state money that we apply for and receive are being spent appropriately. It's one of the high risk areas for a local government, and we need to make sure that we're doing everything we can to both apply for and receive and spend appropriately the money, but also realize that down the road somebody's going to be taking a look at whether or not we did it appropriately, and I'm sure Mr. Mulcahy and staff are well aware of that, but I'll just highlight that. Thank you very much, Mr. Kyler, for bringing this in.
Commissioner Chair Buck and Commissioner Sorensen, you bring up a great point about the importance of really monitoring these dollars closely. Just a little bit more background. I am working with the finance arm of the Emergency Operations Center. We're in the midst of developing a spreadsheet that's tracking some 45 different funding streams within the CARES Act alone. And the idea there is to make sure that we are really creating a paper trail, if you will, that says, where is the money in the bill? Where did it move into the United States Code? What agency then issued a NOFO, Notice of Funding Opportunity, for it? Did we apply? Did we receive? So I think you'll see the documentation that we provide to the county administrator as these dollars come in will be robust. And I will certainly check in with the finance manager is on this team, but we can definitely bring this up to make sure that we're not getting in trouble with a future auditor with respect to these dollars or this new procedure, temporary procedure.
Any other discussion? Seeing none, we'll go to the vote. All those in favor, say aye.
Aye.
All those opposed, say nay. Motion passes unanimously. Thank you, Mr. Kyler. We'll move on to item 9A, Commissioners' Business and Announcements. Are there any announcements from commissioners? Commissioner Sorensen.
Thank you very much. I just wanted to mention that I've attended, I think, all of the Friday COVID-19 phone calls from that the AOC has arranged. And I've asked a number of questions, and usually they've been answered. I just think that it's a really worthwhile phone call to hear what other people are asking about and what the state agency officials are responding and getting really, I think, up-to-date information. And I just think that AOC has really stepped up during this time to provide the assistance to Oregon counties. And I think it's a good thing. And I don't know how long they're going to continue it, but I think it's for the foreseeable future. And I know maybe all the commissioners have been in on those. And I just think it's a good use of our time during the pandemic. And I think that they'll also do more economic impact calls as they did, I believe it was last week, not just the health issues, but the economic issues. And I think it's well worth our time. And just think it's a good thing. I think that Ms. Nickel and AOC is doing a good job in facilitating those. Thanks a lot.
Any other announcements? Okay, I don't see any, so we'll move on to future board assignment requests. Any future board assignment requests? Commissioner Bozievich.
Thank you. I'd like to formalize my request that the board send a letter to the governor asking to maximize flexibility for local governments to approve exceptions for certain businesses to reopen based on our local review of their ability to maintain social distancing and prevent transmission of COVID-19. And maybe have that letter be drafted by staff and come back under consent next week or as soon as possible.
Commissioner Farr.
I would support that with staff writing the letter, particularly in light of the fact that, as Dr. Ludke said, we need to have OHA support for relaxation of restrictions, that it falls within that framework.
Commissioner Bernie.
Before I begin, is this a vote or a head nod thing?
I think it's a head nod for now.
Okay, well, consider my head nodded. Although I do have a question about that. Does that imply a tremendous amount of staff, additional staff work or not, if commissioners have to visit plans of businesses to open early or have waivers or exceptions? And I'm just I nodded in my head. I'm just trying to look at what are the implications of this, if I may. Steve, do you have any sense of it? I don't know.
Well, yeah, I can't answer that question directly because I don't know what all of the implications would be. I mean, I think what Commissioner Bozievich is asking for is on the surface seems to be a reasonable request. I will say we've already, there are things we're already communicating to the governor. Judy Williams met with Sarah Means from the governor's office, I believe yesterday, and at my request asked that the governor consider things like, some flexibility around campgrounds. You brought up campgrounds earlier, and our, we know that in parks, I mean, we are going to be in dire straits with our parks if we can't open our campgrounds for this summer because TRT revenue's gone through the basement, car rental tax have gone through the basement. The one revenue source that we rely on that we can have some element of control over is camping fees. And so the question is things like RVs, can we safely have people there? So that we put that request through the governor that's more of an not informal channel, but through through verbal communications to say, hey, we'd love to see some flexibility around campgrounds. So I think it's certainly a fair request to say we want local flexibility around identifying, kind of what are some particular service areas and small businesses that we can use some discretion with the right criteria and consultation with public health to be able to allow some flexibility there. I think that makes sense. I want to be careful, I think, in that request not to get too specific because I don't know how to answer your question. I think, and I am concerned about that. And I think the business community is going to be looking to Lane County for guidance on things like PPE. Do we need to be wearing masks and gloves? Do we need to maintain 6 feet of distance? Can I open? Can I open? So there is going to be a large body of work in reopening that's going to look different than, I believe, the body of work that happened when we closed. When we closed, the governor put out an executive order and said, basically, it was really clear guidelines. Here's everything in this closing, right? And everyone just fell in line with that. Now, the guidance for reopening is sort of like, well, the governor's going to make the decision on a county by county basis, but it's up to counties to make that request and verify certain things. And then counties have to sort of manage the impacts locally on your own. So I do think that the burden on local government and counties specifically, when we start reopening, is going to be greater and more complex than in a lot of ways the closure was. Everyone looked to the county for public health guidance on things when we close, and that will continue. But now they're going to be looking for more things around, who can be open, who can't be, what are the protocols for being open and closed. So it's kind of a roundabout way of saying, I think there is going to be a significant amount of additional work we're going to have to do in that process. I don't think that's a reason not to make a request for flexibility, because I think there are some legitimate reasons that we probably want to have some of that flexibility. At this stage of the game, I would not get too specific about the type of flexibility. That's my feeling.
Commissioner Sorensen.
Thank you. I think
If others
one
can
thing-
mute, that would be great.
Oh, sorry. Can you hear me okay?
Yes.
Okay. I think that the concept of a letter urging flexibility in the implementation of the governor's executive order, I think is got some there's a question, at least in my mind, as to whether or not we're going to be joining a group of counties that wants to get rid of the executive order and have the decisions of clamping down or easing off be made at the local level. So I think if the letter makes it clear that we are in favor of the state and the health officials of the state maintaining the decision in the broadest sense about how to protect public health, and then within that context, having flexibility among the different counties, I think that appeals to me. But if the tone of the letter is, the essence of it is, we want to take this over and we don't want the state to do this, we want to do it, then that's where I'm kind of off of the letter. But I think that we should just have, I'm in favor of moving ahead with the letter, with my comments being part of my reasoning for wanting to send the letter is that if we can make suggestions on how to ease up and have it be within the context of the state executive order, then I'm okay with that. But if it's to get rid of the executive order and we don't need it and all that. The other thing on the flexibility is I think the flexibility needs to go both ways. So assuming that, the letter is written, we support the executive order, we think the state's health people should be writing these executive orders, governor should be relying on them, and we've kept our numbers low because of them. And then it says, but by the way, we're moving into perhaps a period where we can ease off and that flexibility. But I also think we should anticipate just the opposite. And that is that if we get a rebound, second or third wave, we also want to point out that we also, if we have hot spots that need to be particularly addressed that are community specific, then we need to have that flexibility to reinstate those things. So flexibility both ways. Thank you.
Any other comment on Commissioner Bozovich's request? I don't think we have like a clear idea after all this discussion exactly what we want the letter to state. We're hearing a couple of different things here. I'll do Commissioner Berney, then Mr. Mokryski.
I don't like going before Steve because he always sounds smarter than me, but okay. I think with this direction, correct me if I'm right, both Commissioners Sorensen and Bozovich, but with this direction, a draft letter will be written. The board will have the opportunity to approve that. And therefore, the concerns behind both the request and Commissioner Sorensen's concerns will be met, because then we're going to have to either approve or not the actual letter. And do I have that correct? Okay.
Mr. Mokryski.
Well, what I was going to suggest is, yes, and my suggestion is if their head nods to move forward with the letter, which we want to get clarity on, we'll bring it forward, the draft letter forward for the board's approval next week. I think we should put it on the regular calendar and put it right next to a couple other, the update that we have, and then another potential action we may be asking the board next week on, which is the approval of a board order to verify adequate PPE for first responders. So we have the letter there so that you can discuss and determine whether or not it includes the language that you want to see. My suggestion is that if you want to do a letter requesting flexibility, what I'll do is have our EOC draft the letter. So I'd like Ms. Gaffney and the team in the EOC to draft the letter, because I think we really need to vet whatever we're asking for to make sure that, to Commissioner Bernie's kind of question, do we have the ability to actually implement this and track it and handle those requests, and that it's based, that whatever we ask for is based on, informed by our public health professionals. So that's how I would want to handle that, is that the language, the draft letter would come from the EOC, so you can have some level of confidence that it's actually reflective of that process of implementation that we would foresee.
Commissioner Farr.
Thank you for that clarification, Steve. You know, at the start of the meeting, Karen gave us a 7 bullet points that we're operating under. And I think that letter just needs to stay within the bullet points that were outlined by Karen and by Dr. Lidke, particularly what happens if we have to do a rapid rescale or restart based upon based on widespread second wave. And once again, that we have OHA support on relaxing restrictions. It's all included in the seven bullet points that were read off this morning.
Commissioner Berney, and we are receiving, at least I'm hearing some feedback. If somebody is not on mute, if they could mute, that'd be wonderful.
2 things, and one is actually, Commissioner Farr, it would be a rapid restop is what I think you were referring to. We're trying to restart right now. And that was really the only point I wanted to make, Chair. I just want to state for the record that the very positive and exciting, if we weren't also encumbered by this process, discussion now is we're talking about now restarting. We're talking about now what's the prudent and best way to restart economic activity, to restart livelihoods. And I see the discussion that Mr. Mokrahysky said would occur next week. And I see the discussion of this letter all being part of figuring that out. So I absolutely agree with Commissioner Farr's point and Mr. Mokrahysky's point in terms of constructing this, but I'm also going to look forward to looking at what it looks like, having the opportunity to comment on a draft, et cetera, et cetera. Thank you.
Commissioner Sorensen.
Thank you very much. I want to bring up another topic under the future board assignment request. Is this the right time to do that if we finish the other one?
I want to start by just making sure that we have, it seems like we have at least 3 head nods, so we're good with the first one. Okay, go ahead with yours,
Okay,
Commissioner.
my second, or the second one I want to talk about is getting if there's support for it, getting a work session on the pros and cons of setting up what I'm titling an emergency rental assistance fund. And the concept here is that our public commenters wanted to set up a rental assistance fund. And I think the commissioners are nervous about setting up such a fund because of the expectation it may raise. But I do think there is merit in the idea of having a emergency rental assistance fund, which the purpose of which would be, and the purpose of the work session would be to dive into some of the financial implications of how would we even put money into this, where would that money come from, and then the more significant thing of where would the money go? And my understanding is that if we have people coming up in, in April, May, June, July, August, September, October, the early phase of the real hit on the renters that if we don't have an emergency rental assistance fund, then what we're going to see is massive evictions. At least the landlords have the right, as I understand the moratorium, to then have the evictions. Well, they probably don't want to do that if there's no other people that can afford it. So maybe the market will adjust. But I think if we have an emergency fund, then we can keep some people, not all, but we can keep some people, maybe we have a criteria for that, to keep those people and assist with their rent. I'll just throw that out as an idea. Again, it's not to create, the work session isn't to create the emergency rental assistance fund, is to discuss the pros and cons of creating a emergency rental assistance fund.
If there's anybody on the phone that's not muted, if you could mute also, that would greatly reduce our feedback. Any other discussion on this particular item, which is a rental assistance fund pros and cons group? Mr. Murkowski.
Just not seeing any commissioners jumping in right away. I just wanted to offer a thought about if you want to move forward with a discussion on rental or some kind of pros and cons of the emergency rental assistance fund. This is the type of thing that it seems to me would be really important to have a discussion either with or at least with the context of understanding that it would be more impactful to have other community partners such as, the city governments participate in that. And I'll just say, so as you're thinking about, because clearly rental assistance is a hot topic and a priority and a concern, thinking about federal money that is or may become available, state money that is or may become available, and then what is the role of local government, and making sure that local government doesn't just include Lane County. And I'll just go back to Ms. Gaffney's comment that you heard a report of over $2.7 million in expenditures by Lane County, 75% of which we hope is recoverable by FEMA. But that 2.7, so there's still 25% of the 2.7 million that's been spent to date. Doesn't include the $1.8 million for the purchase of the former VA clinic. So you're looking at, pushing $5 million in investment that Lane County has made in the course of just over a month, $5 million in response to this emergency. And there inevitably is going to need to be more investment that will need to come by our local community. So I just want to advocate, we heard this from the public comment this morning about the youth shelter. I know and I think it's a great sign of where Lane County is at, and a reflection of the fact that people are coming to Lane County to solve community challenges. I want to make sure that Lane County is not the only entity in our community that is stepping up to solve and fund solutions, that we're coming together with various partners in the public and private and sectors. And we've seen our nonprofit, many of our nonprofit providers step up and provide assistance and help there. But the vast majority of the financial impact for responding to this emergency has fallen on Lane County. And we've welcomed that obligation and said that's what our community needs, and we'll step up and deal with it. But I just want to encourage that as we look at recovery, investments in recovery needs, and I think rental assistance is in that boat of recovering from the aftermath of this, as is small business and impacted industry supports and vulnerable communities like the unhoused, that we're thinking about it and making plans and investments with other partners at the table, not just Lane County. So thank you for your indulgence. I know that was beyond what Commissioner Sorensen is proposing. I just wanted to offer that kind of context on how we have been involved and the financial burden that Lane County has taken on, and the need for our community partners to step up and assist in our recovery efforts going forward.
Any other comments on this suggestion? Commissioner Berney?
I think the suggestion's a good one. I think that the flesh Mr. Mokrzycki put on the skeleton is absolutely requisite. I think that when you have an entity that has been stepping up as the county has, all of a sudden the perception is the county is the go-to entity for everything. And I think that's the concern that Mr. Mokrzycki expressed. I believe moving forward, we need a methodology that is inclusive, and that this does not become a county government thing. It becomes a community enterprise. And I believe that whatever normal looks like in the future, it's not going to look like normal in the past. And I think the notion of this type of some sort of rental assistance intervention is right on target, as long as we employ the right methodology, which makes it a community issue, not just one of the multiple governments in the county issue. Thank you.
Any other discussion on this issue? I personally would welcome the opportunity to talk about it further. I think there's a lot of facets to it, and agree that, you know, we really need to think of this regionally with our city partners as well, and what that would potentially look like. Commissioner Sorensen.
Yes, thank you. I agree with really everything that's been said. I agree with Mr. Mokrzycki that we cannot do this alone, and that the other governments and public entities in Lane County, I would even broaden it to school districts and utility districts and the city governments in Lane County. And I think Commissioner Berney broadened it further, and that is that it's also a function of our nonprofits, because they're, you know, mightily struggling to help people, and they have falling revenues just like we do. And so I think that's part of the discussion. And notice I didn't label this as a we will do this. I labeled it as the pros and cons of doing it, because if we really do not have any resources for it, and we're not likely to have any resources for it, it may well be that we just do not want to establish this and then have really no way of following up with it. It may well be that we just have to say that the needs to protect our first responders and the need to have emergency services and provide places for people with the infection to go to and all that stuff, it will exhaust our resources, and also the money that we need for purposes of running the county government, the general fund of the county. So I label this as a pro and con discussion, and obviously staff's role in that will be significant. And for a more conservative perspective that I don't really always take, but just to lay it out, hey, can we be everything to everybody just because our name is so generic, Lane County? Do we have the money and those sorts of more conservative approaches to it? But I cannot foresee that the interests of 50% of the people of Lane County cannot be a concern of this board, and that's why I think we should move ahead with it. Thank you.
I see 3 head nods on this particular item, unless there's any further discussion. Commissioner Sorensen.
I'm ready to bring up another topic if we are done with this one.
Go ahead.
I was hoping we could get a written report, or excuse me, an oral report next week on the status of the homeless kids and children that are trying to be served by a consortium or coalition, including United Way and churches, to help unaccompanied minors or homeless children or homeless kids. It seemed like from Mr. Mokrahysky's report this week that's ongoing and that there's hope to get it going. But I'm wondering if we could just request that next week, Mr. Mokrahysky give us an update on what else needs to happen. This week I heard that one of the drawbacks is apparently the church did not conclude an agreement with St. Vincent de Paul, and that needs to happen. There might be other things. I'd just like to make sure this is not lost and that we're continuing to play a facilitating role in this.
And
Are you
Chair, I
just
can
looking
actually,
I'm sorry, just wanted to clarify, you're just looking for an update. Mr. Mokrahysky.
yeah, I'm happy to provide another update next week because inevitably things will advance in the course of that time. But I'll also just take a moment and provide some additional information that I just got from Noreen Dunnels at United Way and Megan Schultz, who's actively involved with the 15th Night Group. And this is what they say. This is just as of minutes ago. They're working on, St. Vincent de Paul is working on hiring the right people. They have their key staff in place and want to make sure that they have a big enough pool of support staff to run 24/7. They started interviews last Thursday. They're also working with 4J to provide some of the meals and distance learning support. The City of Eugene Library and Recreational Services is going to be providing some activities and tutoring. It's all coming together, as Megan Schultz says, and we're going to put our best foot forward out of the gate. And so they want to make sure that they get this right, because one of the things Megan says here is that, making sure you get off on the right foot from a youth standpoint is really important. So they want to open ASAP, but with all the staff and the basic needs in place, and everyone is shooting for sometime this week for it to open. So there's a lot of confusion from the folks that are planning this work and coordinating this work about. When I relayed the public comment we got this morning from Mr. Brindell, the response I got was, we don't understand why there's confusion, because we're working to get all this to happen. And then from St. Vincent de Paul's standpoint, they need to get a commercial lease agreement with the church. So that's under Mr. Brindell's authority, I believe. So it's all moving forward. And the people that are on the ground, I think you see there is a great example of various community partners in the nonprofit and public agency community that are coming together to help solve that challenge. So I'm happy to provide another update next week on that as well.
Any other future board assignment requests? Commissioner Farr.
Just a response to that to Mr. Mokrahysky, monitoring what staff has been doing over the last few weeks, they've really been operating within guidelines and within our capabilities. I think that everybody's looking to find ways to work outside of the box, outside of the framework that is accepted and is commonly supported. And I know that your staff is looking to do that in every way that they can, working with 15th Night, hopefully with Looking Glass and other nonprofits. So I will look forward to not a report next week, but ongoing contact, what's happening this week. Thank you.
Commissioner Berney.
Very briefly, I just want to thank Steve and others for that background information, because I, for one, that's not what I got from the pastor's public input. So it's very helpful to have a context and to know that's moving forward. Thank you.
Well, last week we discussed redistricting again, and our county council put together a very nice summary of 4 different options in which for us to consider if we want to proceed. Has everybody had a chance to read those? Because we can either discuss, okay, Commissioner Sorensen, you haven't. So this is my suggestion, if people agree, that if we could review those and then perhaps provide some additional direction under future board assignment requests next week. That sound reasonable? Okay. Let's do that.
Thank you. That from my perspective, that would be much appreciated.
Very good. Okay. Any other future board assignment requests? Not seeing any, we'll go to review of assignments.
So I have the 3 that we just talked about. Commissioner Bozovich's request for a letter to the governor to provide flexibility to local governments in implementation of the reopening framework. We'll draft that through our EOC and provide it for the board on the agenda next week for discussion and approval. And then Commissioner Sorensen's request, the first one, to do a work session on the pros and cons of an emergency rent assistance fund. We'll identify the appropriate staff and the timing of pulling together and any needed information for commissioners. Let me just ask on that one, any clarification on, do you want information to help inform that discussion, or is this an item where you just want to have the commissioners talk about the pros and cons and ask me information?
I would say the latter,
Okay.
that it's a discussion of the commissioners and with you, and it may result in, not going further. It may result in a more formal, request for staff to work on it. It may be dropped. It's just a discussion.
Okay. Okay, so we'll schedule that. And then the last one was an update on the status of the youth shelter, and I can do that next week, either under the COVID update or under my announcements.
Okay. I don't see any executive sessions for today, but we do anticipate one happening next week. Commissioner Sorensen.
I'm sorry, I wanted to go back to the review of assignments. Did you, Mr. Mokreisky, did you consider having at the beginning of next week's board meeting, the Board of Health formally waiving or getting rid of the Board of Health item for that day?
Yeah.
So that the public is aware that we made a motion passed today under the Board of Commissioners authority, but we didn't notice a Board of Health meeting for today. So next week we could notice. I just wanted to point out that that was something that was more of a review of assignments.
Yep, that'll be, we'll have that on the agenda, notice for the agenda for the Board of Health to take action on that next week.
Thank you so much.
Diana is on top of it. So I don't have any executive session. Any final emergency business? Seeing none. Any other business that anybody wants to bring up for today? Okay, I don't see any. Just a reminder, we have our budget orientation meeting later this afternoon. So I'll see you all there. And that will be a separate link than this one. And with that, we shall adjourn.